talk about things that have to do with your health. During the coronavirus, hospitals have reported alarming decreases in stroke patients coming in. Doctors think people may be delaying their essential medical treatment for symptoms of stroke. Stroke is the 5th leading cause of death in the United States, and this is Stroke Awareness Month, for example. We want to talk about it. Joining me live is Dr. Clinton Wright with the National Institute of Neurological Disorders and Stroke. Doctor, good morning to you.
Good morning.
Hey, I want to start with talking a little bit about just how alarming this is to you, knowing that more than likely cases aren't going down, but that people aren't coming in to possibly the hospital situation to be taken care of.
Yeah, that's right. We're very concerned about the dramatic reduction that we've seen across the United States in the number of people seeking care for stroke. As you kind of alluded to, about 1 million people have a stroke every year. So it's a big problem in the United States, and it's the #1 cause of adult disability in the country. So we really want to get people the treatment that's available, which is only available for a short period of time after stroke symptoms occur. So there's a window of time when people can get clot-busting drugs, or they can have the clot pulled out in certain cases. We want people to be able to get that, and if they don't go in and call 911, then that's not going to happen.
Yeah, you're talking about some of those blood clots too. We've been hearing when it comes to COVID-19 patients, it's very early on, but we're hearing in some cases, especially with younger people, that you're seeing cases of stroke and or blood clots. Can you give us an opinion, since you're an expert here, like again, obviously very early on, do you have any kind of understanding of what effect COVID-19 is having on stroke in the brain?
Right. Well, we're very interested in that. More research needs to be done on the links between COVID infection or SARS-CoV-2 infection, COVID-19, and the brain, the neurological system, the nervous system, spinal cord, peripheral nerves. We're very interested in those links. It's a little bit early. There are reports, as you suggest, that more younger people that don't have traditional stroke risk factors are having strokes and heart attacks. There are reports among children of inflammation in the blood vessels, for example, of the heart and so on, that may be due to infection with the virus. So these are potential links that we've have early reports about, and really needs more research. It's also important to know that the risk factors for stroke that we are all aware of, hypertension, diabetes, obesity, smoking, things like that, they're still going on, and we want people to know not to forget about those and to take care of those risk factors so that they can reduce their risk of stroke.
Dr. Wright, we sure do appreciate your time. We'll have more information and link folks to how they can get that. We appreciate your time by going to fox59.com/links, things like symptoms, things to look out for. And again, Jim, at least here in Indiana, doctors are really trying to get the word out that it is okay now. They want you to go to the emergency room for those types of things.